What are you finding, would be an acceptable interval to assess your peak heart rate to calculate from?
Yeah, it depends, but I would say in general, 3 to 8 minutes of exercise, maybe. So for what I do in practice, 12-minute Cooper run test, I'll take their max heart rate off of that. By definition, take 12 minutes, see how far you can run. That'll also give you a relative calculation of their VO2 max. If they're not runners, I will use the Concept 2 rower. I'll have them do a 2K on there, set it for 2,000 meters, go as hard as you possibly can, and then I'll have them put a heart rate strap on. The opticals on a lot of the watches are delayed, so you may get vast underreporting on some of those. So I want to make sure they actually have a heart rate strap on, which they can pair to their watch. That's fine.
That's a good tip. Okay.
Yeah, the new optical ones are not too bad. And if you hold a high heart rate long enough, some of them will actually pick it up. But I've done this where I've compared my old Garmin Phoenix to the heart rate strap and without, and I would be off by like 30 beats per minute on the high end on some stuff very easily. And there's literature to support that too. So do 2K on the rower, take their max heart rate from there. Both of those will work pretty good. What I like about that is you get a VO2 max score from both of them. I get their max heart rate. And then if I want to go the extra step, I'll do a 2-minute heart rate recovery test at the end. So the second you're done, what is that max heart rate you were at? And then just breathe, don't move. And then after 2 minutes, what is your heart rate? If I want to get fancy, I can look at a 1-minute interval too. So that'll tell me my parasympathetic recovery. And that is a marker also looking at overtraining, overreaching, that kind of stuff.
And while we're on VO2 max, one of the things I like about the Garmin Phoenix that I wear is it will calculate your VO2 max. I've heard some criticisms that if you're not doing more of a maximal exertion, the algorithm's not super accurate, which
Correct.
Would make a lot of sense to me, because if you're trying to assess VO2 max and you're doing a moderate effort, then there has to be a lot of calculation, therefore a lot of variability, therefore a lot of opportunities for inaccuracies. So you're liking either the 12-minute Cooper run or it was a 2K row all out to get your VO2 max. And I'm assuming you want to use the heart rate strap, but I don't know will the Garmin do that if you're using an external device?
Yep. So all you have to do is you have to set up the Garmin to pair it. And once you set it up in there, it'll actually default to the chest strap.
Yeah,
so
which is what mine currently does. I just wasn't sure if that would throw off their sort of algorithm if it was using an external device. But that's great to know.
Yeah, because you want to calculate, you want an accurate heart rate, because otherwise, yeah. And that's what I've seen with people. The first question I'll ask them is, did you ever pair it to a chest strap? And they're like, no. And then the device has never seen that really true max. So their VO2 max is kind of getting squashed a little bit low in some cases.